Now, in this video, I will discussing about the development of kidney, that is metanephric development of kidney, which occurs in all of the mammals. So, development of kidney it's basically it is divided into two parts. One is the excretory system development, that is PCT, DCT, Henry loop part, glomerulus myomenic capsule development, eta. And another part is that is your collective system development, that is your collecting duct, collecting tubule. That part is development. So let's discuss about the collecting system development of metanephric kidney. So collecting system development which occurs from the uteric bud, which occurs from which arise from uteric bud. So what do we mean by uteric bud? So uteric bud is basically it is derived from the mesonephric duct. Okay. So uteric bud is derived from the mesonephric duct. Okay. So mesonephric duct, it will lead to the formation of the ureter, and ureter it will lead to the formation of the renal pelvis, and renal pelvis to form the major calyx from the minor calyx the collecting duct, and the collecting duct the collecting tubule. So in the decreasing order, that is your decreasing order, but actually in the sense, and we also know the concept, that is from first of all this sequence will be reverse, that is from collecting tubule to collecting tubule. Their formation is the collecting tubule. There is a tubule, you clearly see, that is collecting tubule. This portion is known as collecting tubule, and this portion is known as the collecting duct. So collecting tubule, then collecting duct, it will lead to the formation of the major calyx, then form to minor calyx to renal pelvis, and the ureter is arrest from the renal pelvis, then uteric bud, and then mesonephric duct. So in this sequence we know, but the actually development process occurs in the reverse, that is from the mesonephric duct to uteric bud, ureter, renal pelvis, major calyx, minor calyx, collecting duct, and collecting tubule. Okay, so in this sequence there will be formation of the collecting system. Okay, so now let's discuss about the excretory system development. So this portion is known as collecting tubule or collecting duct. Here you can see that is collecting duct or collecting tubule. So this portion is collecting duct or collecting tubule attached with the metanephric cap. And this is the cap-like structure 2P. Okay, Bengali language that is 2P cap. This is a metanephric cap. Okay, and then metanephric cap will form metanephric vesicle. Clearly see metanephric vesicle, and this portion is known as also an collecting tubule, and this portion is known as the collecting duct. Okay, so then metanephric vesicle it will lead to the formation of the PR shape metanephric vesicle. Okay, so metanephric cap, then metanephric vesicle, then PR shape metanephric vesicle, and then metanephric vesicle lead to the arise of metanephric tubule. Okay, this is your metanephric tubule. Okay, and metanephric tubule invaginous to form there is a cap-like structure, metanephric tubule or metanephric duct invaginous to form there is a tube-like structure, there is a cap-like structure. So this portion is known as the glomerulus, and glomerulus, this is your efferent artery, and this is your efferent artery. Efferent artery means towards the glomerulus, and efferent artery means efferent. It means exit from glomerulus. Okay, and this cap-like structure that is known as the Bowman's capsule, which enclose the glomerular las in partially. Okay, so this is your complete metanephric kidney. So metanephric development of kidney is very important. You should learn the process. This is summary video. So there will be very important sequence step. Collecting system stuff again. If I revise from mesonephric duct to uteric bud to ureter to renal pelvis, then major calyx, then minor calyx to collecting duct and collecting tubule. There is excretory system mesonephric cap which is attached to the collecting tubule. Then mesonephric cap to mesonephric vesicle, then pierce the mesonephric vesicle, then mesonephric tubule to invagination to form a cup-like structure, or other is Bowman's capsule, and glomerulus to afferent arteriole and efferent arteriole. Okay, so there is a complete nephron. Now there is a one ascent of testis, ascent of kidney. As we all know, the descent of testis, it is done by gubernaculum. fibrous band, gubernaculum. In the same way, ascent of kidney is very important. There are two reasons behind the ascent of kidney. One is anatomical reason, and another is physiological reason. Anatomical reason is, so as we all know, kidney is located in the posterior abdominal wall. So from puberty to adult condition, posterior abdominal wall growth will be increases. So there will be growth increases. So kidney will be ascend up. Okay. So first reason will be differential growth of the posterior abdominal wall. Why? Because from puberty to adult condition there will be increases. From fetal to adult condition there will be increases in the posterior abdominal growth. So there will be ascent of testes. And second point is reduce of fetal curvature. Okay. Now physiological reasons, as we all know, kidney is located in the lumbar L1, L2, L3 vertebrae. In case of left kidney, that will be from T12 to L3 and in L2, and in case of right kidney, that will be located in the L1 to L2. So lumbar vertebrae, as both the kidney occupies the pelvic cavity and there is a small diameter of the pelvic cavity, so it will lead to the space shortage. Okay, so first point now it faces space shortage in the smaller pelvic cavity. Okay, so smaller pelvic cavity, okay, due to the smaller pelvic cavity, space shortage occurs. Okay, and second point will be, that is your less blood supply. Okay, less blood supply. Why? Because this is your abdominal aorta. Because kidney, if kidney is located in the region that is your lumbar region, then blood supply will be very poor. But if kidney ascend up in the abdominal aorta, it's close to the abdominal aorta, then blood supply will be more. That is normal concept. Okay, polycystic kidney, it is a clinical condition, and the stone in ureter, that is also clinical case. Stone in ureter, it is known as also ureter colic. Ureter colic means it's a stone in ureter. So what will be the if stone in the ureter, it will be compress the middle obturator nerve, and as we all know, obturator nerve passes from the behind of the kidney and medially to the psoas muscle. So if in the stone in the ureter, it will compress the obturator nerve. So it will compress the obturator nerve, which passes behind the kidney and in the psoas muscle. Okay, so thank you very much. Please subscribe my channel, like this video and share with your friends.